What are the main differences between bremsstrahlung and characteristic radiation in terms of their production mechanisms and applications in radiography? Answer. Bremsstrahlung and characteristic radiation are two primary types of X-ray radiation produced within an X-ray tube. Bremsstrahlung radiation, produced when high-speed electrons are decelerated upon interaction with the nucleus of an atom in the target material. The energy of the emitted X-ray is variable depending on how much kinetic energy is lost during the interaction. It forms the majority of the X-rays produced in diagnostic radiography, particularly at higher kilovolt peak (kVp) settings. Characteristic radiation, produced when an incident electron displaces an inner shell electron of the target atom, causing a vacancy that is filled by an outer shell electron. The difference in energy between the two shells is emitted as an X-ray. Characteristic radiation has specific energy levels that correspond to the atomic structure of the target material, typically tungsten, thus producing X-rays of specific wavelengths. It is most prominent at lower kVp settings. Understanding these differences is critical for optimizing imaging techniques and patient safety. Bremsstrahlung is used in general imaging, while characteristic radiation provides specific energies that can be harnessed in advanced applications like fluoroscopy. In digital radiography, how do the concepts of direct and indirect image acquisition impact the overall workflow and image quality? Answer. Digital radiography utilizes two primary techniques for image acquisition, direct and indirect. Each has distinct implications for workflow and image quality. Direct digital radiography involves the direct conversion of X-ray photons to digital signals using detectors such as flat panel detectors. Impact on workflow. Faster image acquisition and processing lead to shorter patient wait times and increased throughput in radiology departments. Image quality generally provides superior image quality due to higher detective quantum efficiency and reduced image noise. Additionally, DR systems can offer post-processing capabilities that enhance image quality. Indirect digital radiography (CR) utilizes a two-step process where X-ray photons are converted into light by a phosphor plate, which is then read by a scanner to produce a digital image. Impact on workflow. While CR systems are more flexible and can utilize existing X-ray equipment, they involve longer processing times and can lead to delays in obtaining images. Image quality may be lower compared to DR due to potential issues like image blur from motion and low DQE. CR also typically requires more manual handling, increasing the risk of artifacts. The choice between DR and CR affects both the efficiency of imaging processes and the quality of images obtained, which is vital for accurate diagnosis. Mr. Thompson, a radiographer, notices a decrease in image quality during routine exams. After reviewing the quality control QC logs, he realizes that the routine QC tests for the imaging equipment have not been performed regularly. What steps should Mr. Thompson take to ensure compliance with regulatory standards and improve image quality? Answer. Mr. Thompson should take the following steps. Review QC protocols. Assess existing QC protocols to ensure they align with regulatory standards set by bodies such as the Australian Radiation Protection and Nuclear Safety Agency (ARPANSA) and the Australian Institute of Radiography. Establish a regular QC schedule. Implement a comprehensive QC schedule that includes daily, weekly, monthly, and annual tests to monitor equipment performance. This may include tests for exposure indicators, image artifacts, and collimation accuracy. Train staff. Provide training for all staff members on the importance of routine QC tests and how to conduct them. Ensure everyone understands the procedures and their implications for patient safety and image quality. Conduct immediate QC tests. If the imaging quality is currently subpar, conduct immediate QC tests to identify any malfunctions in equipment. This might include checking for correct alignment, exposure settings, and proper function of digital detectors. Document findings and actions. Maintain thorough documentation of all QC activities, findings, and corrective actions taken. This record is essential for regulatory compliance and quality assurance audits. By following these steps, Mr. Thompson can enhance image quality, ensure patient safety, and maintain compliance with regulatory standards. Explain the importance of collimation in radiographic imaging and how improper collimation can affect patient safety and image quality. Answer. Collimation is the process of restricting the size and shape of the X-ray beam to the area of interest. Its importance is multifaceted. Patient safety. Collimation reduces the radiation exposure to surrounding tissues by limiting the area irradiated. This is crucial for minimizing the risk of potential radiation-induced injuries and long-term effects, such as cancer. Image quality. Proper collimation improves image contrast and clarity by reducing scatter radiation, which can degrade image quality. Scatter leads to increased noise and can obscure fine details crucial for accurate diagnosis. By ensuring that only the necessary area is exposed, collimation helps maintain optimal contrast resolution. Regulatory compliance. Many regulatory bodies mandate specific collimation practices to ensure patient safety and image quality. Non-compliance can lead to penalties and increased scrutiny from oversight organizations. Improper collimation can result in unnecessary radiation exposure, loss of image quality, and potential regulatory issues, highlighting the need for stringent adherence to collimation practices in radiographic procedures. Discuss the role of digital image processing algorithms in enhancing the quality of radiographic images. What are some common techniques employed in this process? Answer: digital image processing algorithms play a critical role in enhancing radiographic image quality by applying various techniques to improve visibility and diagnostic utility. Some key functions include image enhancement techniques, windowing and leveling, adjusting the brightness and contrast of the image to highlight specific tissues or abnormalities. Windowing allows the radiographer to manipulate the grayscale of an image to enhance the visibility of structures of interest. Histogram equalization. This technique redistributes the intensity values in the image, improving contrast and making subtle features more visible. Noise reduction strategies. Various algorithms, such as median filtering, can reduce the graininess or noise in images, thereby improving overall clarity. Reducing noise is essential for accurate interpretation, particularly in low-dose imaging scenarios. Artifact correction. Algorithms can identify and mitigate common artifacts such as phantom images or beam hardening, which can distort diagnostic information. Effective artifact correction improves the overall accuracy and reliability of the diagnosis. Image reconstruction techniques. Advanced reconstruction algorithms, e.g., iterative reconstruction, can improve image quality while reducing radiation dose, which is particularly beneficial in CT and advanced radiographic imaging. These techniques collectively enhance the diagnostic capability of radiographic images, ensuring that healthcare providers can make informed decisions based on clearer and more accurate representations of patient anatomy. What are the key factors influencing spatial resolution in radiographic imaging, and how can they be optimized during clinical practice? Answer: spatial resolution in radiographic imaging refers to the ability to distinguish between small structures and is influenced by several key factors. Pixel size. In digital imaging, smaller pixel sizes result in higher spatial resolution. Radiographers can optimize this by using high-resolution detectors and ensuring that the imaging parameters are set appropriately for the examination. Source-to-image distance, SID. Increasing the SID reduces magnification and improves sharpness, thus enhancing spatial resolution. Practitioners should select the appropriate SID based on the clinical situation, balancing patient positioning and image quality. Collimation. Effective collimation not only improves patient safety but also enhances spatial resolution by reducing scatter radiation, which can blur the image. Proper collimation techniques should be employed consistently. Exposure factors. Optimizing exposure factors KVP and MAR can affect contrast and detail. Higher KVP settings can improve penetration but may reduce contrast, while low AVP may enhance contrast at the cost of potential motion blur. Radiographers must assess the best exposure settings for each clinical scenario. Motion control. Patient motion can significantly affect spatial resolution. Techniques such as fast imaging sequences, effective communication with patients, and the use of immobilization devices can minimize motion artifacts. By understanding and optimizing these factors, radiographers can significantly enhance spatial resolution, contributing to improved diagnostic accuracy. In the context of quality control in imaging equipment, explain the significance of the following tests: beam alignment, collimation accuracy, and exposure reproducibility. Answer: quality control UC tests are essential for ensuring the safety and efficacy of imaging equipment. The following tests are particularly significant. Beam alignment. This test evaluates whether the X-ray beam is accurately aligned with the imaging receptor. Misalignment can lead to unnecessary exposure of surrounding tissues and compromised image quality. Regular checks ensure that the beam is centered on the area of interest, reducing the risk of retakes. Collimation accuracy. Collimation accuracy tests determine if the X-ray beam collimates appropriately to the indicated field size. Inaccurate collimation can result in increased patient exposure and unnecessary radiation dose. Regular verification ensures compliance with safety standards and maintains optimal imaging quality. Exposure reproducibility. This test assesses the consistency of image quality and radiation dose across multiple exposures under the same conditions. Variability can indicate equipment malfunction, affecting diagnostic reliability. Consistent exposure levels are vital for maintaining patient safety and trust in diagnostic results. These QC tests are crucial for maintaining imaging standards, ensuring patient safety, and complying with regulatory requirements. Discuss the role of regulations such as the Australian Radiation Protection and Nuclear Safety Act 1998 in the practice of radiography. How do these regulations ensure patient and practitioner safety? Answer: the Australian Radiation Protection and Nuclear Safety Act 1998 establishes a regulatory framework for radiation protection and safety in Australia. Its role in radiography includes standards for radiation safety. The Act sets forth guidelines that ensure the safe use of radiation in medical imaging, emphasizing the principle of as low as reasonably achievable, LORA. This principle mandates that practitioners minimize radiation exposure to patients and staff while maintaining the quality of diagnostic images. Licensing and compliance. Radiography facilities must be licensed and comply with the standards set by the Australian Radiation Protection and Nuclear Safety Agency (ANSA). This compliance includes routine inspections, quality assurance measures, and proper training for staff. Public health protection. The Act ensures that radiation practices do not adversely affect public health. By enforcing strict controls and monitoring the use of radiation in medical settings, the legislation protects patients from unnecessary exposure and associated health risks. Emergency preparedness. The Act outlines protocols for managing radiation emergencies, ensuring that facilities have procedures in place to protect both patients and practitioners in the event of a radiation incident. In summary, regulations like the Australian Radiation Protection and Nuclear Safety Act 1998 are vital for ensuring the safe and effective practice of radiography, safeguarding the health of patients and practitioners alike. Explain the significance of image contrast in radiographic imaging and the factors that affect it. How can contrast be manipulated to improve diagnostic outcomes? Answer: image contrast is a critical aspect of radiographic imaging that enhances the visibility of anatomical structures and pathological conditions. Its significance and influencing factors include definition and importance. Contrast refers to the difference in density between adjacent areas on an image. High contrast improves the visibility of structures, aiding in diagnosis. Low contrast may obscure important details, leading to diagnostic errors. Factors affecting contrast. Kilovolt peak (kVp). Higher kVp settings increase the penetration of X-rays, resulting in lower contrast due to the greater uniformity of attenuation among tissues. Conversely, lower AVP settings yield higher contrast, but may increase patient exposure and risk of motion blur. Tissue composition. Different tissues attenuate X-rays at varying rates, contributing to inherent contrast. For instance, bone appears white against softer tissues due to its higher density. Image processing algorithms. Digital manipulation can enhance contrast post-acquisition. Techniques like histogram stretching and contrast enhancement can improve the visibility of subtle details. Manipulating contrast for diagnostic outcomes. Radiographers can adjust kVp and utilize appropriate filters to optimize contrast based on the clinical scenario. For example, in chest imaging, a lower kVp may be used to enhance lung detail. Advanced image processing techniques can also be employed to further enhance contrast post-exposure, ensuring that critical structures are more clearly defined. By understanding and managing contrast, radiographers can significantly enhance diagnostic accuracy and patient outcomes. How does the interaction of X-rays with tissues contribute to the principles of radiographic contrast and density? Discuss the implications for image interpretation. Answer: the interaction of X-rays with various tissues forms the basis of radiographic contrast and density, which are essential for image interpretation. Interaction mechanisms. Photoelectric effect. This interaction occurs when X-rays are absorbed by dense tissues, e.g., bone, resulting in high contrast. Tissues that absorb more X-rays appear white on the radiograph, creating a stark contrast against surrounding softer tissues. Compton scattering. This phenomenon involves the scattering of X-rays by electrons in soft tissues, leading to lower absorption and resulting in darker areas on the image. Soft tissues like muscles and fat have lower density and thus lower contrast against one another. Radiographic contrast. The differential attenuation of X-rays by various tissues contributes to contrast. High contrast images result from significant differences in X-ray absorption between adjacent tissues, facilitating the identification of structures and abnormalities. Density considerations. Image density refers to the overall darkness or lightness of an image. high-density areas, e.g., bones appear lighter, while low-density areas, e.g., air-filled lungs appear darker. Adjusting exposure parameters (KVP) affects overall image density, influencing interpretive quality. Implications for image interpretation. Understanding these interactions aids radiologists in assessing pathologies. For example, a tumor may present with different contrast characteristics compared to normal tissue, guiding diagnostic conclusions. Additionally, recognizing how different tissue types interact with X-rays informs the selection of appropriate imaging techniques and exposure settings, ultimately enhancing diagnostic effectiveness. By grasping the principles behind X-ray interactions and their implications for contrast and density, radiographers can improve image quality and interpretive accuracy, leading to better patient care. What are the key differences between ionizing and non-ionizing radiation, and why is understanding these differences important for radiographers? Literature review. Conduct comprehensive reviews of existing literature to identify evidence-based practices relevant to specific radiographic procedures. Collaboration with stakeholders. Involve radiographers, clinicians, and patients in the development process to ensure guidelines are practical and relevant. Continuous evaluation and updates. Regularly assess the impact of implemented guidelines on patient outcomes and update them based on new evidence or changes in practice. By adhering to these principles, radiography can enhance the quality of care delivered to patients. Explain the photoelectric effect and Compton scattering, including their relevance to the interaction of radiation with matter in clinical settings. Answer. The photoelectric effect occurs when a photon of radiation strikes an atom and is completely absorbed, resulting in the ejection of an electron from that atom. This effect is more pronounced in materials with a high atomic number and low energy photons. Compton scattering, on the other hand, involves a photon colliding with a loosely bound outer electron, resulting in the photon losing energy and changing direction while the electron is ejected. Relevance in clinical settings. Imaging techniques. Understanding these interactions helps in optimizing imaging protocols. For example, high-energy X-rays are less likely to undergo the photoelectric effect, making them more suitable for penetrating dense tissues. Radiation dose management. Knowledge of how different types of radiation interact with various tissues helps in assessing and managing radiation doses, thereby minimizing unnecessary exposure. Mrs. Smith is a 45-year-old patient scheduled for a CT scan. Upon review of her medical history, you discover she has had multiple previous scans in the last year. Discuss the steps you should take to ensure her safety and compliance with radiation protection principles during this procedure. Answer. Assessment of prior exposures. Review Mrs. Smith's previous imaging records to calculate her cumulative radiation dose. This helps assess the need for further imaging and potential risks associated with overexposure. Justification of the procedure. Ensure that the CT scan is clinically justified. Discuss with the referring physician about the necessity of the scan, considering alternative imaging modalities, e.g. ultrasound or MRI, that may pose less risk. Informed consent. Explain the procedure to Mrs. Smith, detailing the associated risks and benefits. Obtain informed consent, ensuring she understands the need for the scan and the measures taken to minimize exposure. Optimization of technique. Use the ALAI as low as reasonably achievable. Principle to optimize the CT settings, adjusting parameters such as scan time, radiation dose, and field of view to limit exposure without compromising diagnostic quality. Monitoring and follow-up. After the procedure, monitor her for any potential adverse effects and ensure appropriate follow-up consultations regarding her health and imaging needs. Relevant guidelines. RANZCR guidelines on radiation safety and optimization techniques. What are the acute and chronic biological effects of ionizing radiation, and how do they influence dose-response relationships in radiological practice? Answer. Acute effects occur shortly after exposure and can be observed at high doses, resulting in symptoms like radiation sickness, nausea, and fatigue. These effects are deterministic, meaning that their severity increases with dose and there is a threshold dose below which no effects are observed. Chronic effects, in contrast, may take years to manifest and include long-term health risks such as cancer, genetic mutations, and organ dysfunction. These effects are stochastic, meaning that they occur randomly and the probability of occurrence increases with dose but without a threshold. Influence on dose-response relationships. Radiographers must understand the implications of both acute and chronic effects when planning imaging protocols and informing patients. This understanding guides the establishment of dose limits and the implementation of protective measures to minimize risks. Relevant guidelines. ARPA-NSA regulations on radiation dose limits and risk management strategies. Discuss the ALARA principle in radiation safety, including its significance and practical applications in A clinical setting. Answer: the ALARA is low as reasonably achievable. Principle is a fundamental guideline in radiation safety that emphasizes minimizing radiation exposure to patients, staff, and the public. Its significance lies in balancing the clinical benefits of radiological procedures against the risks associated with radiation exposure. Practical applications. Time. Limit the time of exposure during imaging procedures. For example, ensure that patients are positioned efficiently to reduce scan times. Distance. Maximize the distance between the radiation source and personnel. Use lead screens and maintain a safe distance whenever possible. Shielding. Implement appropriate shielding techniques, such as using lead aprons and barriers during procedures to protect both patients and staff. The ALARA principle also involves regular training and education for radiographers to ensure they remain informed about the latest safety practices and technologies. What are the different types of personal protective equipment (PPE) used in radiation safety, and what guidelines govern their use and maintenance? Answer: common types of PPE in radiation safety include lead aprons, protect the torso and reproductive organs from scattered radiation; thyroid shields, safeguard the thyroid gland, which is particularly sensitive to ionizing radiation; gloves and eye protection, used during procedures involving direct handling of radiological materials or exposure to scatter radiation. Guidelines for use and maintenance. Regular inspection. PPE must be inspected regularly for signs of wear and tear. Lead aprons should be checked for cracks or damage. Proper storage. Store PPE in a manner that prevents deformation and damage. Hanging lead aprons on appropriate racks helps maintain their integrity. Training. Radiographers must be trained in the correct use and limitations of PPE to ensure optimal protection during procedures. Relevant guidelines. ARPA, ANSA, and RANZCR standards for PPE use and maintenance protocols. Explain the role of dosimeters in radiation safety, including the types available and the regulations governing their use in a clinical setting. Answer: dosimeters are devices used to measure an individual's exposure to ionizing radiation. They play a critical role in radiation safety by monitoring doses received by radiographers and other personnel. Types of dosimeters. Film badges use photographic film to measure exposure over time, and their simplicity makes them common in various settings. Thermoluminescent dosimeters (TLDS) contain crystals that store energy from radiation exposure, which is released as light when heated, allowing for precise measurement of exposure. Regulations governing use. Personal dose limits. Regulations specify maximum allowable doses for radiation workers, ensuring that dosimeter readings are regularly monitored to maintain compliance. Calibration. Dosimeters must be calibrated regularly to ensure accuracy, and records of exposure must be maintained for regulatory purposes. What are the compliance requirements for facility accreditation in radiography, and how do these requirements ensure safety and quality in imaging practices? Answer: facility accreditation in radiography requires compliance with several key criteria. Quality assurance programs. Facilities must implement and maintain quality assurance protocols that monitor imaging equipment, techniques, and patient outcomes. Staff qualifications. All radiographers must be qualified and licensed according to national regulations, ensuring that only competent professionals perform imaging procedures. Radiation safety protocols. Facilities must establish and follow protocols that align with ALARA principles, ensuring that radiation exposure is minimized for both patients and staff. These requirements are crucial as they ensure consistent application of safety standards, improve the quality of imaging practices, and enhance patient outcomes by minimizing risks associated with radiation exposure. Relevant guidelines. National accreditation standards set by ARPA, NSA, and RANZCR. Describe the emergency procedures and protocols that should be in place for handling radiation incidents and overexposure events. Answer: emergency procedures for radiation incidents should include immediate response. Staff should be trained to recognize the signs of radiation exposure and respond quickly, including evacuating the area if necessary. Incident reporting. There must be a protocol for reporting radiation incidents, which includes notifying appropriate regulatory bodies, documenting the event, and conducting a thorough investigation. Medical evaluation. Provide immediate medical evaluation for individuals suspected of overexposure, including baseline assessments and monitoring for symptoms. These protocols ensure that any radiation incidents are managed promptly and effectively, minimizing potential health risks and ensuring compliance with regulatory requirements. Relevant guidelines. ARPA NSA regulations on emergency response planning for radiation incidents. Discuss the biological implications of dose-response relationships in radiation exposure, focusing on deterministic and stochastic effects. Answer. Dose-response relationships describe how biological effects vary with the amount of radiation exposure. Deterministic effects are characterized by a threshold dose below which no effects are observed. The severity of these effects increases with dose, including conditions such as skin burns and radiation sickness. Stochastic effects, however, occur without a threshold and are characterized by their probabilistic nature. The likelihood of developing conditions such as cancer increases with higher doses, but the severity of the effect does not depend on the dose. Understanding these implications is crucial for radiographers in making informed decisions regarding patient exposure, ensuring that the benefits of imaging outweigh potential risks. It also guides the establishment of safety protocols and patient consent discussions. Relevant guidelines. RANZCR and ARPANSA guidelines regarding dose limits and safety practices in radiation exposure. Explain the anatomy of the skeletal system, focusing on major bones and joints. How does the understanding of skeletal anatomy contribute to effective imaging in radiography? Answer. The skeletal system consists of 206 bones in adults, divided into the axial skeleton, skull, vertebral column, ribcage, and the appendicular skeleton, limbs and girdles. Key bones include skull, protects the brain and supports facial structure. Vertebrae, comprises the spinal column, providing structural support and protecting the spinal cord. Long bones, e.g. femur, humerus, crucial for movement and leverage. Joints, points where bones meet, classified into three categories: synarthroses, immovable, e.g. sutures of the skull. Amphithroses, slightly movable, e.g. pubic symphysis. Diarthroses, freely movable, e.g. knee and elbow joints. Understanding skeletal anatomy is critical for radiography as it helps radiographers accurately identify anatomical landmarks on X-rays, assess fractures, dislocations, and degenerative diseases, and ensure proper positioning to minimize radiation exposure. The Australian Radiation Protection and Nuclear Safety Act 1998 emphasizes the importance of radiation safety and patient care in imaging practices. Describe the major muscle groups and their functions. What imaging techniques are utilized to evaluate muscular injuries or disorders? Answer. The major muscle groups include skeletal muscles, responsible for voluntary movement. Do they work in pairs? Agonists and antagonists for joint movement. Cardiac muscle, involuntary muscle found only in the heart, responsible for pumping blood. Smooth muscle, involuntary muscle found in organs, e.g. intestines, blood vessels, controlling autonomic functions. Common imaging techniques for evaluating muscular injuries include MRI, magnetic resonance imaging, provides detailed images of soft tissues, making it the gold standard for assessing muscle tears, strains, and chronic injuries. Ultrasound, useful for real-time imaging and assessing soft tissue structures. It is often used in sports medicine to evaluate muscle and tendon injuries. Understanding the anatomy and function of muscle groups allows radiographers to accurately interpret images and guide clinical decision-making. The Australian Institute of Radiography guidelines on imaging protocols provide a framework for best practices in musculoskeletal imaging. Mr. Thompson, a 55-year-old patient, presents with shortness of breath and chest pain. As a radiographer, what imaging modalities would you utilize to evaluate his respiratory system, and what specific pathologies would you look for? Answer. In Mr. Thompson's case, the following imaging modalities would be appropriate. Chest X-ray, the initial imaging technique to assess for pneumonia, pleural effusion, or pulmonary edema. It helps identify gross abnormalities in lung architecture. CT scan, computed tomography, provides detailed cross-sectional images of the thorax, allowing for the evaluation of complex conditions like pulmonary embolism, lung cancer, or interstitial lung disease. Key pathologies to evaluate include pneumonia. Look for areas of opacity indicating fluid or consolidation in the lungs. Pulmonary embolism. Assess for vascular occlusions. A CT pulmonary angiography is the gold standard for diagnosis. Chronic obstructive pulmonary disease (COPD). Evaluate for hyperinflation and changes in lung structure. Lung cancer. Identify masses or nodules and assess lymph node involvement. Explain the role of hormones in physiological regulation. How does an understanding of this concept influence imaging practices in radiography? Answer. Hormones are chemical messengers produced by glands in the endocrine system, playing a crucial role in regulating various physiological processes, including metabolism, growth, and reproduction. Key aspects include feedback mechanisms. Hormonal regulation often operates on a feedback loop, negative or positive, ensuring homeostasis. For example, insulin regulates blood glucose levels through a negative feedback loop. Hormonal effects on imaging. Hormonal imbalances can affect the presentation of diseases visible on imaging. For example, hypothyroidism can lead to changes in bone density observable in X-rays. Understanding hormonal regulation influences imaging practices, as radiographers must consider these factors when evaluating pathologies. The Australian Standards for Radiation Protection provide guidelines to ensure safe imaging practices, particularly when hormonal disorders may necessitate advanced imaging techniques. Discuss the pathophysiology of inflammation and its implications for radiographic imaging. How can radiographers distinguish between inflammatory and non-inflammatory conditions based on imaging? Answer: inflammation is the body's response to injury or infection, characterized by redness, heat, swelling, and pain. It involves complex biochemical processes, including the release of cytokines and recruitment of immune cells. Pathophysiological changes include increased vascular permeability, leading to fluid accumulation and edema observable on imaging as areas of increased density or opacity. Tissue remodeling, in chronic inflammation, leading to fibrosis or scarring, which may alter normal anatomical structures. Radiographers can distinguish between inflammatory and non-inflammatory conditions based on imaging characteristics. Inflammatory conditions typically show soft tissue swelling, effusions, and increased uptake of contrast agents in cases of abscesses or infections, e.g., osteomyelitis. Non-inflammatory conditions may present with stable lesions, calcifications, or changes in density without the acute signs of inflammation. Explain the anatomical structures involved in the cardiovascular system and the importance of imaging in diagnosing cardiovascular diseases. Answer: the cardiovascular system comprises heart, a muscular organ divided into 4 chambers: right atrium, right ventricle, left atrium, left ventricle, that pumps blood. Blood vessels include arteries, veins, and capillaries, responsible for transporting blood throughout the body. Valves prevent backflow and ensure unidirectional blood flow. Imaging plays a critical role in diagnosing cardiovascular diseases. Echocardiography utilizes ultrasound waves to assess heart function, structure, and blood flow. It is particularly valuable for evaluating valvular heart disease and cardiomyopathies. Cardiac CT offers detailed images of coronary arteries, aiding in the diagnosis of coronary artery disease and vascular anomalies. Cardiac MRI provides functional and structural information about the heart, particularly useful for assessing myocardial infarction and congenital heart disease. Discuss the importance of understanding the anatomy of the gastrointestinal tract in radiography. What imaging modalities are best suited for diagnosing gastrointestinal disorders? Answer: the gastrointestinal tract comprises several organs, including the esophagus, stomach, small intestine, and large intestine, each playing a vital role in digestion and absorption. Understanding the anatomy of these structures is crucial for accurate image interpretation. Imaging modalities for diagnosing gastrointestinal disorders include barium studies. Radiopaque barium sulfate is ingested to outline the GI tract, enabling visualization of structural abnormalities such as strictures, ulcers, or tumors. CT enterography provides high-resolution images of the small intestine and is particularly effective in diagnosing Crohn's disease, obstructions, or malignancies. Ultrasound, useful for evaluating gallbladder diseases, liver pathology, and other soft tissue structures in the abdomen. Radiographers must apply the principles of patient positioning and radiation safety as outlined in the Australian College of Radiology's imaging guidelines to ensure optimal diagnostic outcomes while minimizing radiation exposure. Describe the pathophysiological changes associated with neoplasia. How can imaging assist in the diagnosis and management of tumors? Answer: neoplasia refers to the abnormal proliferation of cells leading to the formation of tumors. Pathophysiological changes include altered cell growth. Neoplastic cells exhibit uncontrolled growth, evading normal regulatory mechanisms. Tissue invasion and metastases. Tumors may invade surrounding tissues and metastasize to distant sites, complicating management. Imaging plays a vital role in diagnosing and managing tumors. MRI, excellent for soft tissue contrast, making it the preferred modality for brain and spinal cord tumors. CT scans provide detailed images for assessing lung, liver, and abdominal tumors, are also useful in staging and treatment planning. PET scans evaluate metabolic activity, helping to identify malignant tumors and assess response to therapy. Discuss how feedback mechanisms in body systems maintain homeostasis. Provide an example of a feedback loop and its significance in radiographic imaging. Answer: Feedback mechanisms are essential for maintaining homeostasis within the body, involving processes that regulate internal conditions. Two types of feedback mechanisms exist. Negative feedback, the primary mechanism for maintaining homeostasis, where a change in a physiological variable triggers a response that counteracts the initial change. For example, when blood glucose levels rise, insulin is released to lower it back to normal levels. Positive feedback, less common, this mechanism amplifies changes such as during childbirth, where oxytocin increases uterine contractions. In radiographic imaging, understanding these mechanisms can aid in identifying conditions that disrupt homeostasis. For instance, imaging studies may reveal complications of diabetes, e.g., diabetic nephropathy, that arise from the failure of negative feedback in insulin regulation. The guidelines from the Australian Institute of Radiography stress the importance of understanding physiological principles for accurate interpretation of imaging results. Explain the imaging modalities available for assessing the respiratory system and the role of each modality in diagnosing common respiratory pathologies. Answer: various imaging modalities are employed to assess the respiratory system, each with specific roles. Chest X-ray, the first-line imaging technique for evaluating respiratory pathologies, useful for identifying pneumonia, lung masses, and pleural effusions. CT scan provides detailed images and is particularly effective for assessing conditions like pulmonary embolism, lung cancer, and interstitial lung disease. CT angiography is specifically used to visualize blood vessels in the lungs. MRI, while less common, MRI can be beneficial for evaluating mediastinal structures and certain soft tissue masses around the lungs. Ultrasound, useful in guiding thoracentesis and assessing pleural effusions. Understanding the strengths and limitations of each modality helps radiographers choose the appropriate imaging technique based on the patient's clinical presentation. The Australian guidelines emphasize the importance of selecting imaging protocols that optimize patient care and diagnostic efficacy.